afternoon, everyone. Welcome. Thank you all so much for being here. For Andover Elder Services in the Robb Center, this is the first time ever we're doing a Zoom presentation with a live audience. So if we have a few hiccups along the way, I apologize, but thank you for being here in person or on Zoom. So I'm Kelly McKay, I'm the program coordinator. So a few quick Zoom things I want to mention before we get started. Currently the chat function is disabled. We will put the chat function back up and on once the presentation is ready for questions. So for the live audience and for those on Zoom, please hold all of your questions to the end of the presentation. At that time, Lisa will take questions. Also, we are recording this presentation. So if you'd like a copy of the recording, my email will be displayed at the end of the presentation along with the Andover mentors. You can pick and choose who you want to bug for the recording. We will both have it. So I'd like to thank Memorial Hall Library for helping us promote this event, especially shout out to Stephanie Traina for her support. And I'd like to thank the Andover mentors. They will do a better introduction than I will, but John, Jeff, and Roland, thank you for initiating this presentation and for coordinating it with Andover Elder Services, the library, Shine, and yourself. It's not easy to do. And that's all I have. So I'm going to invite up the Andover mentors.
I don't think we're on screen. Lisa is there. It matters.
I don't know how to get our
Camera live.
Our camera is on.
Okay. Good afternoon. I'm Jeff Kaplan from the Andover Mentors. And could we go to the slide with our caricatures? Can I get the next one, Lisa?
Yep. Hold on just a second.
I'm on the right, and I'm going to introduce very briefly Don and Roland.
Hello, I'm Don.
That was brief.
I'm Roland.
Yeah. And the three of us got together about a year ago and started working on something that's been very interesting for the three of our careers, which is sharing information, particularly about financial topics. And Don is a former banker. Roland is a former stock advisor and media person. He knows all these things that I never knew. And I am, background is primarily education and training, and also working with people to try and work on better understanding of the financial world that they're dealing with, particularly in my retirement years. Bottom line, we came up with the name Andover Mentors, and that's what we do. And we're very happy to be here. We spoke with Lisa Rose, who is the manager of the program that you're about to see in terms of, she is a Elder Services of Merrimack Valley and North Shore, manager of programs called Shine. I don't know what the acronym stands for, but I'm sure she can tell us. Bottom line, this program, which is one that they do annually, working with people as the sign-up period for Medicare and, Social Security and the programs that are associated, is made available. All right. I'm pretty much ready, Lisa. I think we can turn it over to you.
Okay, thank you very much. Thank you first of all, to Kelly at the Andover Senior Center, and a big thank you to all of the three of you Andover mentors. It looks like this is my first experience with the Andover mentors, and it's great to see so many programs. Here's a list of some of the programs that they've done in the past. And so they have ongoing programs, and they have reached out to Shine to see if we could collaborate on this great program. And I love the fact that this is an innovative program today, because as you know, some of you are live at the new and exciting Robb Center at Andover, and some of you are on Zoom. So we're pretty excited about that. We did, I have been expecting Deborah Hanson to jump in. She is our Shine counselor in Andover. So I'm not sure what's happening as of yet, but she hopefully will see her jump in. But I do want to say, I love the caricature of the 3 Andover mentors. So we had to have something for ourselves, for Deborah and I. And so as you can see, ours aren't as professional as the Andover mentor caricatures, but you see that I'm on the left. My name is Lisa Rose, a Regional Shine Program Director at Elder Services, the Merrimack Valley and North Shore, and Deborah Hanson, who is your Shine Counselor at the Andover Senior Center. So today we're going to talk about the Shine program, and I know that it was mentioned, not 100% sure of what the acronym stands for, but here it is for you. Shine stands for Serving the Health Insurance Needs of Everyone. We like to say everyone on or eligible for Medicare. What we do is we provide free and unbiased insurance information and counseling to Medicare beneficiaries, families, and caregivers. We like to say that Shine is all things Medicare. And when we say unbiased, what we mean by that related to insurance is that we don't have anything to sell you. We are a federally funded program managed by the State Executive Office of Elder Affairs. And we do take a lot of pride in the fact that we let every beneficiary know what all the options are out there for them on an individualized basis. And we find that to be very important. We have about 700 Shine counselors throughout the state of Massachusetts. I forget how many there are across the country. This program across the country has other names. It is a SHIP program, SHIP. So that's what we fall under the umbrella of on a national level. But in Massachusetts, and it happens to also be called Shine in Florida. We have 14 regions of the Shine program throughout the state. And in our region, Merrimack Valley and North Shore, we actually cover the Cape Ann area as well. We have about 600 Shine counselors. We have about half of them do this as part of their job. They're in kind, it's called. And the other half are counselors they're all extremely dedicated to helping people navigate the challenges of Medicare. They do have extensive training. They have to pass a certification exam. They have to attend meetings monthly to stay up to date. They also are required to recertify every single year to be sure that they are up to date with all of the information that they need to have on hand, to be sure it's accurate that they're sharing with you. And you can find Shine counselors at many senior centers, councils on aging, community-based sites, and hospitals throughout the region. And so we do really appreciate our partnerships with sites like Andover Senior Center, who offer to host the Shine counselors. So what do? We basically explain Medicare and options to people, especially important at this time of year during Medicare Open Enrollment. We work with you on an individual basis to help find the coverage that meets your individual needs. So because Medicare is an individualized program, so in other words, if you're married, you and your spouse may have completely different plans, different ways that you get your Medicare, to be sure. And so we help you identify what's the best way for you to have your Medicare. So also, as you know, your healthcare needs may change year to year. And so we can help in situations such as that. We answer questions that are related to Medicare eligibility, enrollment periods, and all kinds of benefits. And we also refer to other resources in the community if we identify a need where there may be some assistance out there for somebody that's beyond our scope, or to enhance what it is that we can offer. We also assist with billing issues all year long. We are around all year long, where this is our high energy season during Medicare Open Enrollment, but we can certainly help anytime during the year. And the other thing that we do is we always screen for cost savings programs. And I'm going to talk a little bit about that a little bit down the line. One of the things that we did mention earlier that Kelly mentioned, that we did disable the chat feature just because it tends to be a little bit distracting. So what we'd like you to do is if you could just take notes, if you have questions along the way, we will open it up at the end to questions. More often than not, you'll find that we do answer your questions as we move along. So if you have or going to have any of the following healthcare that's listed here, this may not be your Medicare, this may not be your open enrollment. So there's a lot of information that comes out on the television, a lot of information that comes in the mail at this time of year, and we get a lot of calls from people who may currently be working, have an employer group health plan, not ready to retire, they're happy with their plan. We can answer questions around that, but this isn't the time to be concerned about enrolling in Medicare. If you have a retiree plan, so you may have worked for a company and they offer you a plan, this is also not your open enrollment time period. We do ask, if that's your situation, that you do check in with us after the first of the year when we are a little bit, when our resources, we have a little bit more resources available. We are all very busy here. We're more than happy to help you, but we are very busy. So if somebody does come in with a retiree plan, we will ask that if we can talk to you after the open enrollment ends. Also, if you have veteran benefits, you may want a Part D plan. You may or may not need other coverage, so check with your Shine counselor on that. GIC, another form of retiree coverage through municipalities, and federal or any other federal or state retiree insurance. Again, just be aware that this, you may not need to be thinking about your open enrollment at this time. So, you know, you might ask, why is open enrollment so important? What's the big deal here? So as you know, and as I mentioned earlier, that Medicare is individualized. So as I mentioned, married couples may have different types of plans. And so we say, please review your plan every year during this time frame, October 15 to December 7. It's important because if not, you may be in a plan where you're really kind of throwing money out the window that you don't need to be spending. We can help you identify that. The worst thing that we hear, one of the worst things we hear at Shine, is that people will say, well, I'm going to enroll in this plan because my friend says it's the best, or my neighbor, or my spouse. Well, you get it, but we want to say, please don't enroll in plans based on that. It's important that you look at your own individual situation. And so, as I said, your health needs may change year to year. And most important, your health plan or your drug plan can change significantly year to year. And this is the time for you to be looking at that and comparing what's coming down the pike for you as to what you have now. In some cases, it might be the best thing that you just keep what you have, you roll it over into the first of the year and you're good to go. Or it may be that maybe the plan is ending. Maybe you got something in the mail that you didn't know that you received, that you didn't have a chance to read. Annual notice of change. There's a lot of changes coming up next year. And our goal is to be sure that you're in the best plan and that you can save some money. This is an editorial cartoon that actually came out some years ago when the Part D plan started here here across the country. But I really like this cartoon because I do feel like it is a great reflection of what it feels like when you're looking at Medicare. You don't quite understand it. We always want to stress to everybody that understanding Medicare and your choices has nothing to do with your intelligence level. It's like learning a different language, or like trying to put something together like this. I don't know about you, but I'm not an engineer brain and I'm not very good at things like this that they're dealing with there. But the look on their faces of them trying to figure out the Medicare option really depicts what we see on a regular basis at Shine. Medicare choices can be very confusing. So we help people navigate through all of those complexities. We know that it can be overwhelming. We know that you can get slammed with mail, ads on television, That's why we're here. So you might be familiar with this. This is the official Medicare card. It used to be your social security number was your Medicare number, and it had a letter at following your social number that identified how you were getting your Medicare. And this is, so they've since changed the Medicare number. And you can see that it's a series of letters and numbers, not easy to memorize, nor do you have to. But this number is unique to you. It's as unique as your social security number. And so we do encourage you to keep it protected and only share it with providers. The dates next to hospital part A and medical part B, in this example, they're the same, but your card may look different. It may, the dates there represent the date that you enrolled in that part of Medicare. Oh. Hello. Okay. So just remember, please, that Medicare or Social Security will never call you to ask you for your number. They already know it. There are a lot of scams out there. I know that you are aware of that. I know that you're keeping yourself aware of not falling into any scams, but sometimes there's scams that related to the Medicare numbers. Okay, so this shows the various enrollment periods for Medicare, but today we're talking about Medicare annual open enrollment period, which is highlighted in yellow, the third one down, October 15 to December 7. This is the time to review all of your Medicare coverage. If you're new to Medicare, we do have other presentations that are focused on that. That's a different enrollment period, which relates to the top section. We're not going to talk about that today. So I also want to mention that there's the Medicare Advantage open enrollment. That is related to if you have a Medicare Advantage plan and you were enrolled in it as of January 1st at any given year, you have an extended Medicare open enrollment period, which means you could do anything and change your plan through the end of March. So I just want to do a quick check-in and make sure that everyone, that you can still hear me, that I'm still on track here. I'm checking because I did see something come up about entering.
Hi, Lisa. We're all set at the Rock Center here.
Thank you, Kelly. Great, thank you. Okay, so what makes Medicare so complex? Well, it seems pretty basic at first. You can see here, this is a slide that we've created at Shine. We call original Medicare on the left option 1 or Medicare Advantage plan option 2. If you use those terms outside of talking to a Shine counselor related to this chart, they won't know what you're talking about. So we just use this as our a helpful tool for us when we're working with people. So it looks pretty basic. The 2 options, original Medicare, Medicare Advantage plan. However, there are other choices that lie beneath each of these options. And some of the Medicare complexity is found in the language. Remember that we tell people that it's okay if you're confused because it's like a different language. There are often 2 words that have the same meaning. Today, we'll be talking about plans in Massachusetts because our neighboring states have different plan types and options when it comes to original Medicare. Their supplements are very different. On the left-hand side, you can see in blue, we talk about supplements or Medigaps. We're going to be talking about those in more detail, but I do want to say that we are one of only 3 states in the country that have this type of Medigap. So if you have friends in New Hampshire or friends and relatives in other states, and they say, well, I have a Medigap, that it's a G plan or an N plan. Those are different than what is offered in Massachusetts. Also, on the right-hand side, the Medicare Advantage plans, they're county specific. So what is offered in Essex County or Middlesex County may be different than what's offered in Suffolk County or Barnstable County, and so on. Finally, there are over 25 different Part D plans to choose from this year, and we help to simplify all of this for you. But regardless of what may be confusing, we're going to start with the basics. So Part A is the hospital insurance in Medicare, and Part B is the medical insurance. So that's all your doctor's visits and anything outpatient. Part A, you can see that if you have original Medicare or a Medicare Advantage plan, Part A and B are the foundation of both. That's where you start. Part A has no monthly premium as long as you've paid into the system over the course of your working life, a total of 40 quarters, which is 10 years that you've paid into the Medicare tax. Then you don't have a monthly premium for Part A. There is a monthly premium for Part B that may change annually, and this premium may also vary according to your income. The Part B monthly premium this year is $148.50. It will probably change in 2022. The federal government hasn't released those numbers yet. As soon as we have them, we'll let people know, but we just don't have it as of yet. Under original Medicare, in addition to the Part B premium, you would be responsible for the 20% that Medicare doesn't cover. For example, if you have Part B and you don't have a Medigap, Medicare will cover 80% of that cost, and you're responsible for the remaining 20%, which is why people choose a Medigap plan to help offset that cost. Under Part A, you will have inpatient hospitalization costs and rehab costs. We'll be talking about that a little bit. So under option 2, the Medicare Advantage plans, your copays vary according to the plan. There's a host of Medicare Advantage plans available out there, different companies that are selling them. There's a lot of changes coming up in 2022 with some of those. And so another reason why it's important for you to be doing your review. And again, if you have a retiree plan or veterans benefits, you may or may not want to have a supplement or a drug plan, which is why it's important to talk to Shine. So before I go to the next slide, I want to say hi to Deborah Hanson.
Thank you.
Let's see, Deborah, I'm just going to rename you, give you your name here. Is that accurate?
I can't see my name on my thumbprint there.
Okay, so welcome, Deborah.
Thank
Deborah
you.
is our Shine counselor in Andover, as we mentioned earlier, and we're very excited here that you're here with us, Deborah. Thank you.
Thank you.
Okay, so between the Medicare parts and the coverage, so just a reminder for parts of the Medicare to consider. Under original Medicare, Part A is your inpatient and skilled nursing facility, also known as rehab. People may refer to rehab as SNF, skilled nursing facility. That's another one of the acronyms in our wide world of acronyms. Part B is all of your outpatient. That also includes your doctor's visits, labs, tests, all of that falls under Part B. And again, we're going to talk about the Medicaps that you can choose to help cover the costs. And then you have your Part D. Then you have Part C, Medicare Advantage plans. Those are HMOs, PPOs, or new this past year, Medicare savings accounts. These plans, the Medicare Advantage plans, also known as Part C, combine all the benefits into a single plan. Most of them do have Part D coverage. If you have a Medicare Advantage plan, you want to make sure it has Part D drug coverage in it. And if you have a Medicare savings account, you will need a separate Part D plan. That's the only exception for those. The bottom line is we all want to know, how much is Medicare going to cost me? And so the cost varies according to, first of all, whether you've earned enough credits for premium-free Part A, and then your income is does determine your Part B monthly premium. And they do look at 2 years prior, just as a heads up. That's what Social Security identifies what your Part B premium will be. And they are the ones who determine, they look back on your prior 2 years income. So Part D drug plans will also have a monthly premium, deductibles, and copays. So you can purchase the Medigap, as I've said 1,000 times already, or the Medicare Advantage plan to help offset your cost for Medicare. So what can you do during open enrollment? So if you have original Medicare, you can do anything. You can do anything during open enrollment across the board. So this is the time that if you have original Medicare with a Medigap and a drug plan, if you're thinking that you'd rather switch over to a Medicare Advantage plan, you can do that as long as you do everything by December 7th. You could enroll in or change a Part D plan. So if you don't have a Part D plan yet, you can enroll in one. If you have a Part D plan, you can drop your current plan or switch into a new plan. And again, if you're in an Advantage plan, you can change to a different Advantage plan, or you can change to original Medicare. You can get out of your Medicare Advantage plan and go to the original Medicare and start it out on a different path for the beginning of the year. So let's see. If you are enrolled in, as I mentioned a few minutes ago, if you have a Medicare Advantage plan now and you don't do anything during open enrollment, you can make choices and make changes January to March of next year. That's only if you currently have a Medicare Advantage plan. Or if you choose a Medicare Advantage plan by December 7, you could also change anytime during January to March. So if you want to buy yourself some more time, that's your option to do so. Let's talk about the supplement plans, the Medigap chart. So as I mentioned, not everything is covered by A and B, so you can purchase a Medigap or a supplement plan. You have to have A and B. I'm going to pull up the Medigap chart so I can explain the Medigaps a little bit easier to you. So can everybody see the Medigap chart here? Deborah, can you see that?
Yes, I can.
Great, thank you. Okay, so here's something to know about Medigap plans and original Medicare. Any provider that accepts Medicare accepts the Medigap coverage. So you can go to any provider in the United States and they will accept your Medigap plan along with your Medicare. There's no network restrictions. And as long as it's a Medicare approved provider, they'll take it. And I mentioned that Massachusetts is one of 3 states that have very different Medigap structure than other states. And so we want to be sure that you know that. And if you're talking to a family member, that's why. If you have a Medigap plan and you move to another state, if you have one of these and you move to another state, you can keep it as long as you continue to pay your monthly premium. You don't have to switch into the other kind of Medigap if you choose not to. So I'm going to explain this chart. So here's how they work. Here's how the Medigap plans are structured.
Lisa, sorry,
Yes.
can I pause you for a second? Is there any way you can zoom in and make the chart a little bit bigger?
Yes. By doing so, I believe I'm gonna have to just maybe scroll a little bit here and there, but if I do, I'll scroll slowly so nobody
That's
gets.
much better. Thank you.
Great, thank you. Okay, so we do have on the next page that I'm going to show you, there are some numbers highlighted in yellow for the information that isn't out yet, that hasn't been approved yet through Medicare. But as it stands here, on the left-hand side, there's a list of companies that sell these Medigap plans. These are the plans that are available for 2022. So you can see there's, what do we have? 7 plans, 7 companies that sell them. There are 3 plans at the top of the page. I'm looking at the Supplement Core, the Medigap 1A, and the Medigap 1, or also known as Supplement 1. Now, the only way that you could enroll in Medigap 1 is that you had to have been eligible for Medicare prior to January 1, 2020. Even if you didn't take your Medicare till after that, if you were eligible for it, you can enroll in one of these plans. If not, you can enroll in the Medigap 1A or the Supplement Core. Now, I want to point out, I'm going to use Blue Cross as an example here, only because the first one on the list in its alphabetical order. So I just want to show you that you can see here under Supplement Core, the 1A and the 1, that there's different monthly premiums for these. Some of the plans offer additional benefits, like you can see Blue Cross offers an additional vision and hearing. And if you wanted those options, the rate with the asterisk is the rate you would pay. If not, if you don't want those options, you pay the rate that's listed first. You can see that some other plans also have some other additional benefits. I want to mention that these benefits aren't completely comprehensive, but it could be very helpful. So if you're interested in those, we do encourage you to look at those. So you can see if we look down the column of each of these types of plans, there's all different rates. So monthly premiums for these plans. You can see if you go to a 1A, the rates are going to be higher than Core. If you go to 1, they're going to be higher than 1A. So it all depends on the benefit that you're getting with that monthly premium. Now, it doesn't matter which company you choose. They all provide the same benefit depending on the type of Medigap you buy. For example, if you purchase the Supplement Core through Blue Cross at $113.58, you're going to have the same benefit as you would with Fallon or Harvard Pilgrim and so on. What I'm going to do is I'm going to go to the second page and it's going to tell you what you get for the monthly premium, what benefit you receive on these Medigap plans. So this is the back of the chart. And on the left-hand side, it tells you what falls under each part of Medicare. So under Part A, we talked about inpatient hospital, inpatient mental health, skilled nursing facility, and blood. Under Part B, it's all of your medical coverage. As we mentioned, anything at the doctors, MRIs, tests, everything under Part B. So here's where what a Medigap can do for you. I'm going to start with Supplement 1 and 1A because they're the most comprehensive in line of coverage. So if you purchase a Supplement 1 or a 1A, you can see all these zeros. What this means is there's no cost for you out of your pocket for these benefits. So if you have a 1 or a 1A and you go into the hospital, you're covered in full at the hospital. If you go into inpatient mental health, covered in full. Skilled nursing, you go into rehab, days 1 to 100, you don't have any cost. If you're in for 101 days or more, you will be responsible for full cost. Generally, what we've seen is that at that point in time, if you are in at that on the 101st day or more, they're generally suggesting other options for you, whether going home or into a long-term care facility. And then there's the annual deductible under Part B. So this is federally based. This is standard across the country. Under Part B, if you have the 1A, you will be responsible for the first $203 at the doctor's office for any doctor's visits or outpatient services until that $203 is met. Once it's met, you don't have any other copays. You're not paying for anything else for the remainder of the year if you have the Medigap 1A. If you have the supplement 1, you can see that there's no annual deductible under part 1, supplement 1. If you do the math at the beginning of the year and you were to figure out your monthly premium for 1A and add in the annual deductible, you may be saving some money as opposed to going into a supplement 1. So if you have a core, now the core is the cheapest on monthly premium. So this is what you would need, you would have for other responsibilities out of your pocket. If you go into the hospital, you have to pay the first $1,484. That's the rate for this year. The government has not yet determined or announced what the rate is for 2022. But for this year, it's $1,484. So that's for a 60-day benefit. So for example, you go into the hospital for the, let's say you have this benefit starting in January. Let's say you go into the hospital February 1st, you're in for a few days, you come home, you're responsible for the $1,484. If you go back into the hospital in the first week of March, you're not responsible for another $1,484 because you're still in that 60-day time frame. As soon as that 60 days is over from your first inpatient hospitalization date, then it starts over again. That's the guideline for the supplement core. After that, if you're in for days 61 to 150 or more, you're only paying that $1,484 again as a 60-day benefit. Now, the other thing to be thinking about is a skilled nursing facility and rehab. So with the core plan, you have the first 20 days is paid, and then you'd be responsible for $185.50 a day. Again, it's highlighted. The number hasn't been announced yet for 2022. And so one of the things that we love about this is that it's constant open enrollment in Massachusetts with these plans. So if you have a core and you know you're going to be going in for surgery, you know you're going to be staying at a skilled nursing facility, moving into rehab, you can switch in advance. You do have to do it month to month. Everything starts on the 1st in Medicare. It would be something that you would need planned. Obviously, you can't call from the corner in the emergency room and see if you can change it if you know you're getting admitted, but it is an option. However, when you are hospitalized, if you are not in the hospital for 3 consecutive midnights and then go to a rehab, your rehab may not be covered. So that's the observation period, something you can talk to your Shine counselor about for more information. And again, the annual deductible, same thing on the core plan. You're paying the annual deductible and then you're covered. Now, some of these plans do cover some costs while you're traveling abroad. You can talk to your Shine counselor about that, or you can talk to the plan. There are travel plans that you can purchase that are completely outside of Medicare. If you're traveling, we do encourage that you look into that. So that is the Medigap. Medigap's explained on the chart. So as I mentioned, we'll take questions following the presentation if you have any on the Medigaps. Now, Part D plans are also, it's super important to review this every single year, because sometimes we hear people say, I have the best plan, it's working for me, I don't need to do anything. That's a misconception, because it could be working great this year and next year could be a whole different ballgame. So here are the things to consider when you're looking at your Part D plan, the things that can change. So this year, for example, we have 26 drug plans to choose from. Next year, it's going down to 21. So there's a clear indication that if you have a Part D plan, there may be significant changes in your plan. You would have received a notice already from your plan. And if you didn't receive your annual notice of change or you didn't open it, please find it, open it, or call your plan and ask about it. Or check in with your Shine counselor and review your coverage, and we'll be able to tell you. all of the plans have a monthly premium. That's the monthly cost that you're paying for the benefit of having your plan. Some premiums, they vary greatly and they can change year to year. As a matter of fact, we're getting some calls because some of the plans have increased their premiums quite a bit for next year. So watch for that, please. There's also deductibles. That's an annual cost, and that varies year to year and plan to plan. And the deductible doesn't always apply to every single med. So I think the most that they can charge for deductibles for 2022 is something like a $480. I think that's the amount. So your copays are obviously what your cost share is at the pharmacy or through mail order. The formulary is a list of medications that are covered. That can change year to year. So on the formulary, every medication is assigned a drug tier. It's what determines your copay on that plan. And some meds, some plans may have restrictions on certain medications, such as quantity limits, prior authorization, or step therapy. The step therapy means that you would be required to try other meds prior to the approval of a certain medication. And then there's the pharmacy choice. The plans contract with different pharmacies, and that can really make a difference in your copay. So for example, for the same medication on your plan, you may pay a certain amount at CVS and go across the street to Walgreens and pay a different amount for the same medication, and vice versa. So super important to know what pharmacy your plan contracts with. So to help you determine the most cost-effective plan, we do this every year. We do thousands of plan finder reviews, and Deborah will be more than happy to help you compare your plans to determine if you're in the best plan for next year or if you should consider a change. Now, you might have heard of or experienced the donut hole, also known as the coverage gap. Not everybody has this experience. This is directly related to your drug coverage when you have Medicare. So I'm just going to give you a simplified version of the donut hole because it is based on a formula. Nobody understands the formula unless you're a real math person. And even that, the numbers are can be a little bit gray in the formula because there's a lot of variables behind the scenes that we don't have specific numbers on. But here's the overview. Here's what you need to know as a Medicare beneficiary. When you go to the pharmacy at the beginning of the year, you're paying your copays for your meds. In the background, the pharmacy is tracking the retail cost of your meds, not just what you're paying for your copays. So when the retail in 2022, when the retail cost reaches $4,430, that's when you're going to hit the donut hole. And what happens is how you know that you hit that is because you'll go to the pharmacy and you may have your $9 ready to pay for your copay. And the pharmacist may say to you, no, that's $79 today or $159 today. And you're probably going to have a little bit of a shock. Once you get past the shock, it may be that the pharmacist is telling you that it's the donut hole. And so what's going to happen is you're going to continue paying higher copays until you hit the out-of-pocket threshold, which is $7,050 in 2022. And again, that's not, you can't figure it out by what you're paying out of your copay. It's a formula based on the retail cost of the meds. Once you hit that $7,050, then you're at catastrophic cost sharing, where at that point in time, your cost share will go down. And so remember that this isn't going to happen to everybody. It doesn't happen if you have low-tiered meds. A Shine counselor can help you determine if this is going to happen by using the plan finder tool that we use, which we're going to show you or tell you about, that you could do on your own if you choose to. But super important to remember that this is what it's all about. And we are around all year long. If anything happens at the pharmacy that surprises you or anything changes, check back in with us and to see if there's something we can help you with. So here's one tool that this is our first line of defense. If somebody says, you know, I'm concerned about the donut hole, or it looks like I'm going to hit the donut hole, we say enrolling in Prescription Advantage, it could help you with your costs during that time frame. Prescription Advantage is not a drug plan. It's a state pharmaceutical prescription assistance program through the state. It's funded with your tax dollars. We encourage you to enroll in this if you're eligible. It's not a separate plan, drug plan. It's not an Advantage plan. This is it's called Prescription Advantage. So for most people, or many people, this is a free program, and the eligibility is based on income. The income guidelines are very generous. It's worth looking into. It's not like a lot of the other programs, the cost savings programs that are out there. They're very generous guidelines, and depending on the income, some people do pay an annual membership fee of $200 for this program. We can help you, Shine can help you determine if it looks like it's going to be worthwhile for you if you're in that category, and would it be worth it for you to pay that $200? And if you're eligible for Prescription Advantage and you're not going to hit the donut hole, or it doesn't look it on the report, then we encourage you to enroll anyway. We encourage you to even make the call today. You can call the number on the screen, I sound like I'm on TV now, 243-4636. Just choose the Prescription Advantage. It's a great customer service team. You can tell them that you heard about the program and you're wondering if it looks like it would be something that would be beneficial for you. Because what happens is, if you have this program and you hit the donut hole, it's going to pick up your extra costs based on the level of eligibility. So it really can save you a lot of money. The other benefit is you get a special enrollment period once per year. So when somebody calls us in June and they say, I went to the pharmacy, I don't know what's going on, my meds not covered, whatever the case may be, we ask, do you have Prescription Advantage? Because if you do, we can look at other drug plan options for you, and you can change your plan once per year. So we talked about Part A, Part B, Medigap, and drug plans. And so now we're going to talk about Advantage plans. It's not as long, it doesn't take as long for the Advantage plans. So the Advantage plans, as you know, are also known as Part C. Some people refer to them as replacement plans, but these are separate from Medicare. It's a Medicare Advantage plan, but it's outside of original Medicare. So most of the ads that you might be seeing on TV, okay, so you might be seeing Joe Namath, you might be seeing Doug Flutie, you might be seeing JJ Walker, or some others that you recognize that are talking about these great plans that are zero premium and you don't pay anything, and you might even get money back in your pocket from your Part B premium. Well, we like to say, just be an informed consumer. Remember that nothing for nothing in this world, really. And in the ads that they're referring to generally are SCOs, they're senior care options plans, meaning you're eligible because you're eligible for Medicaid, also known as Mass Health, or and Medicare. So those are very specific programs. So what happens is, if you call the number on your screen, they will, and you don't qualify for those benefits, they'll probably just suggest another plan for you that may or may not be in your best interest. So just keep it in the back of your mind. Even if you do decide something looks good, check in with your Shine counselor and see if it looks like it might really be a good option for you. So Medicare Advantage plans, they really do tend to attract people who are not high users of medical services and they want a lower premium plan. So as I said, there are HMOs, PPOs, and Medicare savings accounts. The other thing about Medicare Advantage plans is that they do offer enhanced benefits and additional benefits like vision, hearing, dental, fitness, and some of them have cards that they'll give you that they put some money on for you for your over-the-counter meds or over-the-counter items. But it's important that you consider all of the costs that are associated, not just the additional benefits that you may get. And, there's a lot of other costs behind the scenes with the HMOs and PPOs and MSAs. So you're probably more familiar with the HMOs and PPOs, very similar to what we have when we're working, that our employer group health plans offer. We will talk a little bit more about the specifics in a moment. Medicare savings accounts are new in Massachusetts this past year. They're similar to health savings accounts that an employer may offer, where in this case, the plan that offers it in Massachusetts puts money into an account for you, and you use that money towards your costs. The thing to remember about this is a few things. Number one, you would be responsible for all your costs. So it may or may not be a beneficial option for you. You would need a separate Part D plan because this is the only exception for an Advantage plan where they don't offer Part D coverage. And so before you do enroll in an HMO or PPO, we do encourage you to check to see if the prescription drugs you currently take are covered in the plan that you want, that you understand what all of your copays will be for different services. And most important, if your doctor and all the providers you want to see, including the hospitals, are in the network for that plan. We also encourage you to, if you are choosing a new plan, that your doctor is accepting, quote, new patients under that plan. I've heard that some of them have a cap, but I haven't heard that in a little while. Worth looking into. So there's a few commonalities with HMOs and PPOs. So the coverage is provided through private companies. They have networks and they may require referrals. So there's no deductible under these plans like there is under Part B, that $203 we saw. But there's out-of-pocket maximum. And so those can vary plan to plan. So they may range from $5,900 for the year or maybe up to $8,700. Those are out-of-pocket maximum, and those numbers are just examples that I've used. So what that means is if you have one of these plans and you reach that total amount, and that doesn't include your meds, the drugs in the plan, for the copays that you're paying, you don't have to pay anything else out of pocket for the remainder of the year if you reach that maximum. But it's wise to determine if you think you're going to meet that amount, because if so, it really may be more cost effective for you to be an original Medicare with a Medigap and a Part D plan instead. Again, individual, check on the individual situation. So they may have copays for Part B medications, and this is super important that you know about it. So more often than not, the average for Part B medications under the HMOs and PPOs, you would be responsible for 10 to 20% of the cost for those medications. Those are medications that you get at your doctor's office or at a facility. For example, chemotherapy, dialysis, any injections you get, infusions, those all fall under Part B. B as in boy. There is, again, 10 to 20% on an average that you'd be responsible for those. You will have copays for all of your Part A and B services. So there's various copays depending on the plan. So if you remember on the Medigap or original Medicare, there's a standardized rate that the government sets for your inpatient hospital stay. It's different with all of these plans, and it does vary plan to plan. Also, the other costs to consider are costs for other services, lab work, x-rays, MRIs, anything like that. There's separate rates for each of those services. The HMOs and PPOs, they may, many of them cover prescription drugs. There's a few that don't. Super important that you make sure that yours does, even if you don't take any meds. And that goes for original Medicare. If you don't take any meds, just please take a drug plan, the cheapest one out there, because you don't want to end up with a penalty if you don't have drug coverage. And then again, like original Medicare, the HMOs and PPOs do not cover foreign travel. You will have coverage in an emergency. And then just a helpful hint, if you use Medicare.gov that we're going to show you to compare your costs, the health care costs are estimates on there because it says your estimated healthcare cost on that report does not mean that it's geared to that they don't have a crystal ball. Let's just put it that way. Your coverage could change year to year, your needs. The drug cost estimates are the drug costs on any of the reports that we run on Medicare.gov or you could do on your own are also estimates. Usually pretty close, but they're estimates. And so this chart explains really the specific differences between an HMO and a PPO, and it's super important. We encourage you to determine, again, if all of your providers or hospitals that you want to visit are in the plan that you're interested in. So with the HMOs, they do require a primary care physician, and all the providers that you go to see must be in that network, and you get referrals for those. For the PPOs, you have more flexibility. You may not be required to list your primary care physician. You can go in or out of network for the plan. You'll pay different copays, whether you're in network or out of network. Sometimes they're extreme difference, sometimes they're not. And then there's no referrals are required. So a lot of times people like the PPO as opposed to the HMO, but some people prefer the HMO. They are all, the providers are expanding their coverage for PPO. So you may find providers in other states where you wouldn't have before. And so just a couple before, as we start to wind down, a couple of helpful tips on trying to decide what type of Medicare is best for you. Original Medicare with a Medigap or an Advantage plan. This is what we see. Original Medicare with a Medigap are usually more often selected by people that have ongoing medical conditions or more needs for services. Again, such as infusion therapy, chemo, or anything like that. Also, if people want flexibility and they don't want to be concerned about referrals or anything like that, they like the predictability in their costs, and it's something that's affordable for them. If people are snowbirds, they often like this way to get your Medicare. So again, you can see any provider that accepts Medicare. The downfall on the original Medicare is that some of the skilled nursing facilities stays and some routine services, such as vision and hearing, may not be covered. You'll have additional copays with Medigap Core than you would with 1A and 1, as we saw on the chart. For the Medicare Advantage plans, generally lower premiums. Many of the Medicare Advantage plans actually have a 0 monthly premium. And these are often selected by people who don't often see providers. They want a plan that they don't have to worry about the monthly premium. They may want additional benefits, such as vision, hearing, dental, fitness, and that they're comfortable with network plans. And again, there's no requirement of a hospital stay for a skilled nursing facility with the Advantage plans. And with the Medicare savings accounts, again, this is really new this year. There's one company in Massachusetts that sells these, that manages these plans. It's Lasso Healthcare. We do encourage you, if you're interested in this type of a plan, go onto their website and take a look. There's videos, there's all kinds of information. And I believe there's even a chat feature, or you can call and talk to somebody. The one thing about these plans is they don't have a Medicare Part D plan. And just remember that, and excuse the typo in the word exception here. Sorry about that. But some people really would benefit from this type of a plan. So how can Shine help? So with all of this information, you're probably already glazed over. We know that's what happens when we do these presentations, but really the Shine counselor can help you narrow down the most cost-effective plan. There are plenty of assistance programs out there that may help. Some of them are connected with Mass Health, which is also Medicaid. There's Medicare savings programs, which that can help pay for your Part B premium, your Part D plans. The extra help is for Part D. We talked about Prescription Advantage. There's also, we have resources to help connect you with access programs for cost savings for drugs and some different drug coupons. And so these programs are based on income and or assets, and they vary greatly. So it's very well worth just checking in with us to see if there's something out there that could be beneficial for you. And also to check in after the first of the year, because these rates, the eligibility guidelines change after the first of the year. Now, when it comes to vision, dental, and hearing, Original Medicare doesn't offer vision, dental, and hearing benefits unless it's medically necessary. As we speak, there's a lot of advocacy going on in Congress to add these benefits to Medicare. You may have heard about it. You may have seen some stuff in the news. We encourage you to call your congressman or congresswoman to let them know how important it is to you to have access to these services in Medicare. So some Medigap plans, as you saw, offer some additional coverage in these areas. Some Advantage plans offer additional coverage, and you can purchase a dental plan outside of Medicare. We have three pages worth of dental resources that we can send to you if you ask us for it. It lists dental resources that are in the community, as well as dental plans. And you are educated or you wouldn't be here today, and we know that, and we really appreciate you spending some time with us today. And so when you're considering your plan choices, ask yourself these questions. Will my plan cover all my drugs? How much is it going to cost me? Is there a deductible? Will my doctor or hospital take my plan? Will I hit the donut hole, the coverage gap? And if I will, when? We use Medicare.gov to search for the most cost-effective Part D plans or the Advantage plans. We do thousands of these every year. It's what Deborah will do to help you narrow down what your options are. The number on the screen is a number that gets into our regional office. Kelly is going to share some information with you as far as, and Deborah will share some information with you about how to work along with Deborah for this, if you'd like some assistance. And if you decide to do it on your own, anybody can do it. We do say, please be sure you're using .gov, no other dot, because you'll end up somewhere else in a plan that where somebody, in a website where somebody wants to gather your information and reach out to you and sell you something. The Medicare summary notice is something to watch for all year long. It's sent to you quarterly. Review it carefully to ensure all of the services that are billed for under your Medicare number are accurate. We do encourage you to do this, help reduce the billions of dollars in Medicare error, fraud, and abuse across the country. And you can call the Senior Medicare Patrol, is a program here across the country that if you suspect any error, fraud, or abuse, please give them a call and they'll help you identify. And they also, this is a little bit more information about the Senior Medicare Patrol and their program mission. They are available for presentations as well, and they want to empower and assist you to help to prevent, detect, and report healthcare errors, fraud, and abuse. So next up, Deborah's going to jump in and she's going to share some information with you about what you have up there on the screen. Deborah?
Thank you, Lisa. First, I wanted to talk about appointment availability. I'm doing phone appointments on Tuesdays and Thursdays. The open enrollment period, the appointments tend to fill up very quickly. So call as soon as you can. When that happens, though, you'll be referred to the regional office in Lawrence, and they'll be able to help you. You'll talk to a Shine counselor there. Phone appointments. Interestingly, I was talking to a couple yesterday that I hadn't spoken to or seen since 2019. And I asked them at the end of the conversation how the phone experience was compared to meeting in person. And they said that they had a lot of trepidation about using the phone and they weren't looking forward to it. But after it was over, they decided that it was just as good as meeting face to face. And it does have its own vibe. So please don't hesitate because of the phone situation. I wanted to just sort of explain how it works so you can sort of know what you can expect. If you have a computer, we will work together we can do plan finders together. We can go to websites together. I can send you emails with attachments and you can open them and look at them. So you'll always have a visual and you won't have to just listen to me talking. We'll be looking at things together and talking about them. If you don't have a computer, what I usually do is do a plan finder if that's part of what you're interested in doing. And then I mail a copy of the plan finder and other information about Medigap plans or Medicare Advantage plans and then we make another appointment so that when you have those things in front of you, we can talk on the phone again and we can talk through the options that you have. The drug plan reviews, they are, what we're doing, what we did last year, which worked really well, is when you call to make an appointment, they're going to ask you from the front desk whether you're calling just for drug plan review. If you're calling because you're considering options and you're considering other changes, then she'll make an appointment with me. But if all you're doing is a drug plan review, just an annual drug plan review, they will send you a form to fill out. And many of you have probably already done this. You fill out the form, you put it in an envelope, it goes back to Shine, and then they will run a plan finder for you and send the results to you. The reason we do this is because plan finder reviews usually don't take a whole hour. So rather than use up a whole Shine hour appointment for just a drug review, it's easier to do it. Somebody can just crank these out, do several in an hour, and then send you the results. So thank you, Lisa. During the question period, if anyone has any questions, I'd be happy to answer them.
Great. Thank you very much, Deborah. And thank you again for all the amazing service that you offer through Shine. We do have this slide that has a whole host of helpful resources for you, different resources that we use, that we collaborate with, or that we refer to for any additional assistance that you may need that's outside of our realm. And then, okay, so looks like we're all set here. And so I'm going to turn it over.
Thank you, Lisa. Thank you, Deborah, so much for that wonderful presentation with a whole lot of information in it. Up on the screen now, you can see my information. So if you'd like a copy of this presentation, please email me. Also, as Deborah mentioned, we do set up those Shine counselor meetings. So I recommend you either call me or you can call our front desk. So that's 978-623-8320 instead of the 72. You can see that right there. So you can set up your Shine appointment that way. Always feel free to contact me for anything as well. And I think we're ready to open it up to questions. So if you're live here in the audience, raise your hand. We're gonna have Jeff reiterate the question. If you're on Zoom, please put your question in the chat feature.
First, let me say thank you so much for an in-depth and really informative program. We
Thank you.
have heard often how very wonderful the SHINE programs are, and they sure do a good job, as we've just seen. What we're going to do is we're going to have people here ask questions, which I will then repeat for the counselors to respond to. There were probably some online as well, and I imagine, Lisa, you're going to handle those. Shall we start with
Sure.
people in the room? Okay. John.
One thing I'd like just to ask, if you could make the screen available with the phone numbers. Kind of hard for everybody to write them down, so if somehow, Lisa, you could send it here or just email that screen and it'll be available for people to pick up.
Or can you back up a second, because I almost had it written down.
Okay,
So, when you zapped it.
okay, hold on just a second.
While Lisa's doing that, you can also contact the Andover Mentors. We're at Andover Mentor. We'll have that up for you in a minute. But the bottom line is, please don't hesitate to add your questions to our list of things to do, because this is both complex and a very valuable program. I think there's things here that just may need a little clarification to your case.
Okay, so was there another slide?
Yes, the previous slide.
That was it. Oh, that.
Yeah, as Kelly mentioned, I can email this presentation to Kelly and she can share it with you if with anybody who would like it, if you want.
I
If that would be
emailed
helpful.
everyone that checked in today and registered.
Great, thank you, Kelly.
You know me.
If you did not check in, speak to me at the end and I'll jot your email down.
What's that?
Lisa, I let them know that they can give me their email and I will share this slide with them if you send it to me.
Excellent, thank you.
The whole presentation,
All right. Questions in the room?
because of the dollar amount.
Yes.
When do they anticipate getting the finalized 2022 numbers from the federal government?
The question is, when do you anticipate getting the final numbers from the federal government for the 2022 year?
So last year, they came in, I think, in the second week of November, which is very challenging. We all know that because it is a factor in our figuring out what what we can anticipate to pay out of our pocket. But that's as soon as we have that. I suppose what I could do, I'm not sure how to go about sharing that. Maybe send something to Kelly, or Deborah can send something to Kelly. When we have the updated numbers, as soon as we have them, we could do that.
Next question, please.
Lisa and Deborah, there is a question in the chat function. Can you pull that up?
Sure. Can you see that? So Catherine asks, I'm going to be helping my folks as they sign up this year. Is there a handout of what information we should have pulled together before we meet with our SHINE counselor? So we do have a form. It's called our Plan Finder Comparison Form, or we lovingly refer to it as our goldenrod sheet because it's on goldenrod paper. That we could send to you if you'd like, or you can connect with Deborah. And if you have that, that's very helpful to have completed on both sides prior to your appointment.
Other questions, please.
Okay, there's another question in chat from Joyce. The Medigap Policy 1 is noted as being available to people who are eligible as of January of 2020. Would that mean that someone who was age 65 on that date is eligible? I believe it is on or before that date. I believe, I can't promise because I don't recall, but if that's, Joyce, if that's your situation, you could either check in with us at Elder Services, or you can check in with Deborah and we'll get that answer to you. I don't recall. But thank you for asking.
The address for the Andover Senior Mentors, by the way, is andoverseniormentors@gmail.com. Yes.
If somebody is in a donut hole right now, what are they supposed to be?
Can you say it just once more?
If somebody is in a donut hole,
Ah,
this year for now,
okay, if there's a person in the donut hole at this time, what are their opportunities to get some help? Is that what you're saying? Okay, so how can they help themselves if they're already in the donut hole?
Okay, so I would call Prescription Advantage you must not have it if you are experiencing the donut hole extra cost. In some cases, depending on the eligibility, depending on what level of eligibility you fall under, they may be able to jump in and help you while you're in the donut hole. If you're in the category where you have to pay the $200 for the year, that's S5. They can't look back. But other categories they can. So I would suggest it does require enrollment in Prescription Advantage, does require an application process. They can do it over the phone. They will tell you what you need to send to them for verification. And once they receive that and you qualify, then it would start right up. So I would encourage you to call them sooner rather than later if it looks like you might be eligible.
Lisa, can I just jump in for a second?
Yes.
The Prescription Advantage, sometimes people don't understand that they need to give the information on the card that they get to their pharmacy and sometimes to their mail order people. The accumulation of benefits, the accumulation of costs that will get you to help in the donut hole doesn't start until you communicate that information to the insurance company. So sometimes people have Prescription Advantage, they don't do that, and then they get to the donut hole and there's nothing that they can, then there's no accumulated cost there to help them in the donut hole, and they have to do a claim and it gets more complicated. So that's something to keep in mind. When you get a Prescription Advantage card, be sure to read the material and that will instruct you what to do. I also just wanted to jump in to number 2 and get back to Joyce on her question about when does the eligibility start, and I'm just reading from the form, only available if eligible for Medicare prior to 1/1/2020. So it wouldn't include, if you turned 65 on 1/1/2020, you wouldn't be eligible for the supplement 1.
Thank you, Deborah. Thank you.
Other questions in the room?
just tell Deborah we miss her. Being
I'm sure I've met a lot of you, but I can't see anybody. So, but hi to everybody that I've met in the past. Hope to see you this season.
All right. Thank you so much for your participation, and thank you again so very much, Deborah and Lisa, for your just excellence in presenting the information. It was very much well received here.
excellent.
Thank you. Thank you all. Thank you all for spending the time with us today. We know how exciting this topic is. And, you know, we always say, could you think of anything else you'd rather be doing right now?
I can think of a few things that are less complicated, but as far as excitement, no, I can't imagine one. Anyway, thank you very much and have a pleasant evening.